When we arrived here, it was a small village of about 50 people, and they were so excited that somebody was going to come give them a hospital here. The government gave us the land in 2003. In 2010, the hospital was open. At that time, we had a 30-bed hospital. Since then, the hospital has grown. The surrounding area has grown from about 50 people in our area to over 175,000 people. We started with a staff of about 30 people. We're 120 people because our hospital has grown also from a 30-bed hospital to a 70-bed hospital with an OR, a small pharmacy, lab, vaccination, dressing room, and women, men's ward, and children's ward. That's been a real blessing to these people to have this department and to work with the children. We also have a psychologist who is working with the families to help them, because many times, as you know, in Africa, these children are hidden or not taken care of. Youssouf, Kikef, ça va? We are seeing over 500 patients in our emergency room now a month. The maternity started out with a 4-bed maternity with 1 delivery room, now has 4 delivery rooms and 13 beds in the maternity, and we're now doing over 200 to 220 deliveries in our department. I was looking up again yesterday the number of physicians per population, so it's 0.058 physicians to 1,000 people. There's very few doctors in this area, so people often have to travel miles to find somebody. There was a young man, a young boy of 14 years old. He was malnourished, so I thought he was about 8 to 10 years old when I saw him. So he had traveled about 12 hours to get here to the hospital. And later on, I found out that he had probably a cancerous tumor of his leg, and he ended up having to go to the OR for an amputation. Probably that leg had been growing, that tumor had been growing for years. And if he could have come earlier, we could have treated him probably. But that's not always the case because they cannot get to the hospital. People have to go miles and miles. We've had people from CAR, Cameroon, Sudan coming to the hospital. Also, another challenge is, especially during rainy season, the malaria. The people don't use mosquito nets. They don't use prophylaxis, and children come at a late stage with cerebral malaria when malaria goes to the brain. And we have lost many children because they come too late. A lot of it is because they don't have they don't have money, or they live very far away and they can't get to a hospital in time. We see many of those cases on and off. Chad is the 3rd to 4th poorest country in the world. There's a lot of poverty around us, so a lot of it is, one is finances. Our patients do pay, and we cover about 90% of our expenses for the hospital, but there's still a big gap. We have a poor fund to help those people who really cannot pay for surgery, for medicine, for just general care. The other really big thing is lack of personnel. Some of our biggest needs are surgeons, OBGYN, and anesthesia. Our surgery is done with spinal anesthesia, especially spinal and ketamine, and general anesthesia. We do have a machine, but we need more trained nationals and people to come and help, come alongside us to do more training so that our level of surgery can increase more. A short-termer could come for 2 weeks, 3 weeks, a month, up to 2 years to stand along with us, with our staff to help teach. You come here for spiritual reasons, because you feel God has given you a gift that these people don't have around here. There's so few surgeons in this country. So few qualified surgeons in Chad or other difficult places. God wants us to use our talents, and that's why we're here, to use our talents to bless other people, just like God has blessed us. It's not easy. The work conditions are hard. We don't have everything we need. We are here to provide the best possible medical care that we can. We're always looking to grow spiritually and as a healthcare facility. And we welcome anybody and any support they're willing to give, however little or in any capacity here at our hospital.